We are from AHS South Zone, and this is how we implemented the MMSF at the Cardston Health Center. We were in the process of implementing the elements of collaborative care, improving the patient and family input and connection with the care at the site, and we were working towards achieving compliance with continuing care health service standards. So we took the framework and included that in with those other 3 projects and just took a really broad view of the care that patients were receiving, how it felt for them, how safe it was, and tried to bring all those elements together. So we took the framework and put it through the lens of those different pieces as our way of measuring whether we were successful or not. So we had the families and the patients come with the staff and everybody bring forward any concerns they had or questions they had or things that maybe didn't quite feel right for them, to look at safety in a more broad perspective rather than just past harm. Because that was something we were really good at, was past harm. We have reporting and learning systems. We have ways of being reflective. We pull our stats. We know what has happened before and we try and prevent it from happening again. But we hadn't ever really looked at it from a perspective of how does the patient feel right now? What's the feel that we have on the unit? What helps us to go, let's ask some questions about this, or maybe let's look at this a different way. And I think it really helped the staff to be able to say, I'm not really comfortable with how this is, or I've identified something that maybe in their mind they would have thought, well, this is an equipment issue, but really it's a patient safety issue. So it brought things forward and changed the way the staff looked at it and the way the patients were communicated with about it.
Well, my experience actually began about just over 7 months ago because of when I took over covering for this site. But my experience has been, and it kind of goes hand in hand with what Jen was saying, is that it's allowing staff to look forward for safety as opposed to always reflecting on something that's already happened. Now they're able to do a little better job of anticipating what might be coming so that they can prevent it. Which I think is really the goal, or the overarching goal, of the MMS framework. I think that it's empowering staff to make decisions where they maybe didn't feel empowered to make those decisions before, where they were able to, in a moment, just in time, go, that might not be safe or that might not be the right thing, and they feel like they can do something about it right then. We've established safety huddles and those opportunities for staff to come together, and they do come together to talk about things. But now they're doing it, I would say, even less formally. So even in the moment that they discover something, they don't wait for the safety huddle, they come together as a group and they actually address those issues right then. And so I kind of would define that, I'm not sure if it's a definition, but it's constantly on the staff's minds. Like, they are constantly aware that that's part of ensuring that everyone is remaining safe, and it's on their minds all the time.
It sounds simple, but I think something as simple as a bed. There was a bed that was malfunctioning, and all of the staff knew that the bed was malfunctioning. But then when they stopped and somebody said, is care safe today? One of them went, well, there is this bed. And they all went, yeah, and everybody sort of connected, this is a safety issue. So it was something that I think like you said, staff really felt empowered to take that information that's really simple information, but say this could have the potential to create a safety issue for this resident, and to be able to say, how are we going to move this forward? So I think that piece of them really saying, let's talk about this, let's do something about this, rather than acknowledging it and then in hindsight saying, oh, I did notice that. I think it really helped them to be proactive, which was great to see, because the staff are really engaging with it, and it's great to see them feel empowered to do so.
I think leadership has a tremendous impact on it. I've supported it, so since I realized I was going to be there for as long as I have been there, I turned to Jen and Adele, who's the other person, and I said, okay, I think I need to be looped in a little bit better into what's going on with this, because I was definitely a fish out of water. So once they looped me in, I understood that I had a role to play in supporting it, and then attended all of the meetings and encouraged the staff and became much more involved in it. So certainly leadership has to be a part of it. There's no question that leadership has to be a part of it. In Cardston, we saw a bit of flux there, but we at least had the stability of having a couple of people that were involved right from the beginning.
I think the inclusion of everybody on the team was really important. So I think that very collaborative, broad perspective of team was essential. When we started, we sort of had one person that was leading a lot of the work at the site, and she was really keeping a lot of that and sort of delegating out and doling those pieces out. And I think the leadership that Cheryl brought when she came was to really spread that out and make sure that with all the competing priorities, with the many things to do, that staff were brought to the table and that there was a lot more inclusion of all the other pieces. And I think bringing all those teams together and everybody having an awareness and a voice really helped to build the capacity for this framework to work in the site.
In order for this to work, you actually need to include all the players. There's no way that this is going to work without the RNs and the HCAs and the maintenance people and our, and our QI people. Like all of those people, the management, we all need to be participating in that, right down to rec therapy, and because it's not just physical safety of people, it's psychological safety and emotional safety. Like all of those components in this kind of came through as we worked through this. So all of that, it's all those teams have to be brought into, they all play a role to build that team and to make it sustainable.
The level of conversation has grown exponentially. The capacity for people to bring those things forward has really grown. Before, like Cheryl had mentioned, it was very traditional where the manager and the charge nurse made the decisions, made the calls, and it was sort of the communication was not a broad one. It went from the charge nurse and back, whereas now I think there's a lot more communication between all those teams, and I think it's really broadened out.
What people talk about is different as well. So the conversation, they have more conversations, as Jen was saying, and they're talking more specifically about some of the, what is safety? Are we safe? Are residents safe? So they're talking about things differently as well, in a way that they hadn't before or hadn't even considered before.
I think one of the strengths of what our team has done is that we did layer the framework with the collaborative care elements, with the patient and family experience, and with the continuing care health service standards. So when those elements are already being discussed at the other sites, so I think it does create a platform for this to spread in a way that is cohesive with competing priorities, which helps us to manage them more at once. It was really important when we looked at the 5 dimensions to look at what are the anchoring questions that go with each of the dimensions. So when we shared it with staff or patients or families, we didn't necessarily present it as this dimension or this dimension, but we presented it as, has care been safe in the past? How do you feel care is safe today? What's your feeling about how prepared we are, how much we're anticipating. So we did have a lot of anchoring questions.
I think it was difficult for even some of our staff to conceptualize reliability, sustainability. When we presented it like that, there was some staff that found it hard to conceptualize. What does that actually mean? What does it look like in my job today? What does that mean to me today in my work? And so going back to those questions is when it made it more real for them, and they were able to kind of wrap their minds around, oh, that's what you mean, that's what you're looking at. Especially since we have people that work with us that English is a second language, and all of those components you have to take into consideration. And so I completely agree with Jen that we needed to present it in a way that made sense to the people that we were talking to.
The confidence growth has been amazing to see in the staff, how confident they feel and how empowered they feel to bring things forward and to deal with them. Not to just tell the charge nurse so that she can deal with it, but they can deal with it. They can have those conversations and bring those things to the person that they need to make change, which has been great.
For me, and again, I've only been a part of this for less than half the time, but for me it was when I realized how powerless the staff felt to do things. I did not realize how that was until they started expressing, well, can I do this if I see this? And I was able to say, absolutely, you absolutely can make those decisions independent of me. If you see a safety issue, please don't wait for me to do something about it. Please do something about it. Let me know about it, but please do something about it. And I didn't anticipate that they felt that they couldn't until that moment. And then when they realized that they had the support of management and others to move ahead, I didn't realize how much that would mean to them, that they could do those things, and it kind of gave them back the power to make decisions. And so for me, that was an aha moment. Everyone has a responsibility for safety, and so it's starting to make a team function together and well. Not one person should take ownership of this. It belongs to a group of people, and that's really the only way you'll ever be able to sustain it and keep it moving forward. Like, a manager can't own it and be the one to dole out everything, and not even a charge nurse or anything like that. It actually belongs to a team of people, and that team of people, that's how they're going to grow as a team, and that's what's really going to make people safe.